Everyone, welcome to the monthly Manhattan Community Board meeting of the Health Seniors Community Board 3 meeting of the Health Seniors Human Services, Youth Education and Human Rights Committee. My name is May Lee and I am the chair. We have a big agenda for us tonight. But before we start that, let's take the attendance. Thomas?
Okay.
Can you take the attendance?
Yes, May Lee,
Here.
Thomas present. Larissa? Is Larissa there?
No,
Okay. Ana Calderon?
she's not.
All right. Eric Diaz?
Yes,
Thank you. Larry Fenn? Larry?
She's not.
Shirley Fennessy? Shirley? Deborah? Is Deborah with us?
I'm here. Yep, I'm here.
Appreciate it. Alicia Lewis Coleman? Alicia? Heidi Schmidt?
She's not.
Heidi? All right. Arnett?
Here.
Thank you. Rodney? Rodney Washington? And Carmen.
yeah.
Thank you, Rodney. And Carmen? Carmen?
She's not.
All right, thank you so much.
Okay, thank you, Thomas. So we'll get started right away because I know that our first speaker has to leave in a little while. Our first agenda item will be the on their website. It's on our agenda. It's solutions, short timeline mental solutions to our mental health crisis in New York City. However, tonight we will put in particular focus on the newly announced City Council's mental health roadmap. So we have with us Carlina Rivera. She is the City Council member of Council District 2. And later on, we'll also have Dr. Van Yu, who's with Genyan Healthcare and CUCS, their affiliates. Carlina, go ahead.
All right, well, thank you so much for having me. Hi, everyone. I'm Carlina Rivera. I'm the City Councilwoman, proudly representing Community Board 3. I just want to say for the record, I want to thank you all because the resolutions that you put forward, how you confront and handle and manage really serious and sensitive situations related to healthcare, including not too long ago, the sweeps on the streets of people experiencing homelessness. You've always led with compassion. And I really, really appreciate our partnership in this work. I think many of us know what underinvestment in our mental health care system does. There is a real intersectional crisis happening right now when people who are experiencing mental health issues, they are unhoused, they're unemployed, they're involved with the criminal legal system. And that is just really because we have not created a pathway and a structure to support these individuals. And today, the New York City Council actually heard a package of bills, which I'm proud to co-sponsor. I introduced them with Chair Linda Lee and a couple of others of my colleagues. It's called the Mental Health Roadmap. It's to, I guess, to put it simply, it's to improve the capacity and availability of mental health care services. I think it's a very thoughtful package of proposals that will help us reach an appropriate and holistic mental health care system that it's currently overburdened and it's certainly ill-equipped to respond to the current crisis. You're going to hear from people who are doing this work who understand that there is funding for many of these initiatives, programs, and services, but we're also very short on healthcare workers. Retention is important, and ensuring that these individuals who are working in this sector feel valued. And so that's something else that is discussed in the mental health roadmap of workers themselves. So what I appreciate is that the City Council is also very honest in the mental health roadmap, and we say what the things that we are capable of, and then also our expectations for the state and federal level. Right now, the state and federal level, the shortage of psychiatric beds, inpatient beds, the expansion of that, the reimbursements that are not happening in many respects. So whether it's working with someone like our state senator, Brad Hoylman, Siegel, or even with Congressman Dan Goldman, who just reintroduced the Michelle Go Act, which is about Medicaid reimbursement for psychiatric beds, which was previously introduced by former Congresswoman Carolyn Maloney. I think that's an important bill as well. And so right now we're discussing the executive budget in the city council. And I did get a few notes from the committee that I'm going to go through somewhat briefly, only because of my time constraints. And I'm sorry about the technical issues, but I'm also very happy to come back. So some of the things that we are discussing right now are Be Heard, IMT, clubhouses. These are already, they're funded and they're funded by the city. And I'll give you the executive budget numbers because I actually have them right in front of me. In the executive budget right now, what's allocated is $27 million for Be Heard and $2 million for club houses. The council has actually called for more investments in IMT, and we plan to push for this through the executive budget hearings. I think many of you are aware of the process of the budget, but we're going to have a bunch of executive budget hearings in chambers and City Hall. And then the council is going to go into this intense negotiation process with the mayor. And again, trying to push on our priorities, which are, of course, community board priorities, because I always look at the community needs and your district statements to put forward my own agenda. One question that I also received was about MSBI and the behavioral health respite beds. So that's what people were calling Rivington House. Right now, to my understanding, when we discuss crisis respite centers, they're saying there is going to be one in every borough at the very least. From my understanding, the Crisis Respite Center in Manhattan is actually going to be community access at 315 2nd Avenue. And the council is calling to add $4 million in funding to these programs. Mount Sinai has, and you all know this because you've been involved in this issue, has long planned their behavioral health services on Rivington Street. So I don't know if they would be part of this program or eligible for this funding, but I have already put the call out to Mount Sinai and I hope to get that answer for you right away. One thing that you ask is how can Community Board 3 be the most helpful to support more mental health resources for Community Board 3? I think having the data as to whether it's children in crisis or families, that's clearly helpful. This will also be helpful. I feel a resolution supporting the mental health roadmap, that legislation and some of the budget initiatives would be helpful. I would include everything. I would even include the things that the mayor has already agreed to fund. So the Be Heard and the clubhouses. It's not that I don't trust City Hall, but you know, people say one thing sometimes and then move a different way. So board with serious needs is an important part of the process and the fight. One thing I would like to mention is that in order to specify resources that are needed in CB3, I think Manhattan, as I mentioned, is often looked at as a place that does not need community investment. They just think we're like an island full of rich people, I'm sorry to say, but we know the need is high here. We have the data, we have the anecdotal evidence, and we know because the partners who are in this very Zoom are doing the work. And it's important to emphasize that. So I'm gonna be fighting for this kind of investment in the Lower East Side. And again, I just wanna mention, I said this, but I think before the recording started, but you know, the number one funding issue, and you'll hear this from experts, I think is higher pay for human services workers. Currently, there is substantial staff shortages, and only better pay or pay parity is going to resolve that. You have to value these workers. And so what is the best way for you all to include this? I think is to include COLAs at the very least, right? A cost of living adjustment. I think there's a lot of points of advocacy. You could write a resolution on just this topic, actually, but I'm not trying to give you all more work. or a resolution on council initiatives with this, the COLA, as your top priority. or you could write a letter to the speaker and our office. I'm certainly always here to be copied or to be addressed. The last thing I'll say is that, Schedule C, which is not an easy document to read on the City Council website, actually lists every single dollar in terms of where funding goes to programming and services. And if you open Schedule C for the last fiscal year 23, you go to page, I think it's 65. There's mental health services and a lot of the organizations that are directly funded with City Council funds. Not only do I advocate and push for that sort of citywide initiative funding, but I also fund programs within our school systems, our hospitals, nonprofits, etc. So just to, I can take, a couple questions before I go, but I think a resolution would absolutely be helpful. I think supporting the mental health roadmap in terms of those legislative priorities, mentioning funding that has already been mentioned by the mayor, but just to really highlight it as important, whether it's clubhouses or IMT or Be Heard. And I also think mentioning at the top of the ticket, the COLA and helping the workers is really, really important. So I wanted to bring that information to you. Again, we heard legislation today. Clearly, the Department of Health and Mental Hygiene was there to testify for, I would say, maybe about an hour. I was surprised. I just thought they would be present a little bit longer, but it was a lot of information to get through. And of course, we heard from advocates and the public. So we're going to take that information. We're going to try to move this package of legislation forward. And of course, under Chair Lee's leadership, Chair Linda Lee, I'm hoping that we can get some of this stuff passed and clearly funded fully. So with that, I could take like 2 questions and then I gotta run. I'm so sorry.
No.
Okay, if you have a committee members, if you have a question, can you raise your hand?
Eric,
Eric Diaz.
Hi, Carlina. Quick question regarding the migrants communities. To what extent is there any priorities for them as we kind of figure out how to deal with this community board being kind of a haven for just really hundreds and hundreds of Spanish-speaking migrants? If there's any information on that.
Well, let me say I was at a church in the Lower East Side a few months ago where asylum seekers, migrants came because there was not only resources from city agencies, but clothing and other sort of important basics available by an organization called Aid for AIDS, which had started as an AIDS organization, but now has really transitioned to being an organization that helps many individuals. And to see the line of people there and hear their stories, there is the number of, and I can get these numbers for you, the number of migrants that have come to New York City are in the tens of thousands, clearly. What the mayor has said is that a lot of really the main reason for a PEG, which is a program to eliminate the gap, which are cuts to city agencies, the reason for that is because of sort of the expenses that have come with serving asylum seekers and migrants. I feel, I think we can walk and chew gum. I think we can find a way to, serve these families and these people in need while recognizing that the investment has to come in the workers that are seeing these individuals every single day. In terms of extra funding, I will tell you that, like, for example, some of the schools in my district that have seen a high number of families come in, most of them Spanish speaking, we've tried to get them additional hours or an actual social worker or even teachers that speak Spanish. I mean, even that's a shortage. It's really, really kind of mind-boggling to see all the needs that are coming in. But in terms of additional initiatives, the council itself is looking at that, and we're looking at how we can challenge the mayor, but also get him to expand sort of what he's doing right now, which is just really turned out to be, a couple of central shelters that haven't quite worked out. I mean, there's got to be a different model of service, and I think we're exploring all of that.
Thank you. Yes, perfect. Thank you.
Oh. Let's see, Susan?
Okay, so I'm surprised to hear that regarding the schools, because I know the superintendent for District 1 had told us that we had many empty slots in District 1 in schools that had resources for dual language. And I'm wondering if the migrant families are being assigned to the right schools, because I know we complained about one, which your office was aware of, about students assigned in a Chinatown school. Are the students being assigned? Is anyone looking at what schools have the resources and empty seats before assigning?
This is a really important question because, as you mentioned, we do have seats, and I feel like we have the culture of our community board in serving these students, especially those who speak Spanish or English as a second language. To me, I have just a better capacity for that in school district 1 compared to school district 2. So to your point, many of these families are in PS 116 on East 33rd Street in school district 2.
That's right,
And it's
my-
really because of like geography and like the proximity to some of the shelters in Midtown. And so we're trying to figure out how we can get these students, in schools where they're going to be properly served and supported. So actually, Katie Loeb in my office, my chief of staff, she's point on this. And we've actually reached out to Carrie and the superintendent of school district 2 to figure out how we can do something that makes more sense.
Okay, great. Any other questions? Carlene, I did have one question. I don't see any other hands raised, but I had one question about the clubhouses and the Be Heard program. Is there any information about the locations that they're looking at?
Not yet. I mentioned about it, how the rest presented in terms of community access and whether or not MSBI and other partners of ours are going to be included. So I have to just get a little bit more details for you, May, and I'll get that to you as soon as I can.
Okay.
Well, thank you, everyone. Thank you for the time. Thank you to our partners I see in the Zoom who are also going to be presenting. Thank you for all your work, and I'll see you all soon.
Thank
Okay,
you.
Okay, thank you, Carolina. All right, great. Okay, so our next speaker will be Dr. Van Yu. Is he still here?
I'm here.
Oh, there he is. Okay,
Yeah.
good. Okay, thank you. Yeah, go ahead. Yeah, go ahead and introduce yourself and your organization and what you do.
Sure. My name's Van Yu. I'm a psychiatrist. I'm the chief medical officer of an agency called the Center for Urban Community Services, and it's healthcare affiliate Janney Medical Care. And I think, well, I'll tell you a little bit about the agency. So we're a fairly big social service agency that provides a lot of different services for people with lived experience of homelessness. We, for example, we operate a couple of shelters, a couple of safe havens, a drop-in center. We're the lead organization for the Manhattan Outreach Consortium. So we oversee all of the street outreach in Manhattan. And I believe the team, so Manhattan's divided into 4 sort of sections, and the downtown Goddard outreach team is the team that's, I think, the relevant one for this conversation. And then Janney Medical Care, and we also operate a lot of supportive housing. And Janney Medical Care provides all this psychiatry, primary care, street medicine, and nursing for all those programs.
Okay, great. So I think we also wanted to know about how things are working. I heard that there's a lot of systems in place, but
Yeah.
things don't really work well. So we want to know how to advocate to make things work better. And why is it not working now? I mean,
Sure.
it was described as there's a lot of things going on, but not necessarily coordinated, for one thing.
Okay, okay,
I
sure.
meant one thing. I think there are
Yeah.
many things. I mean, I was,
Yeah.
I wasn't part
Yeah.
of the pre-discussion, so if you could just, we want
Sure.
to know what we can do to, advocate to make things better, whether it's more funding, when it's change in programming, whether it's
Sure.
the pay that we are talking about, the higher pay and COLAs and all that, so please,
Yeah, I'll actually start by
Yes,
saying like that things actually do work well, even though I get why it doesn't seem that way, right? So for example, the Manhattan Irish Consortium in the last 12 months has placed, I'm not going to get the number exactly, 1,000 people in transitional housing. So that's like safe havens, for example, or stabilization bed programs, and about 300 people in permanent housing, right? And that's sort of an average every year. So if you do the math, the consortium has solved street homelessness in New York City like many times over since 2007. But what ends up happening is that, every time we place someone in housing or transitional housing, that person sort of ends up getting replaced by somebody else, and which is a phenomenon I don't totally understand. Anyway, my point of saying that is that the system, so street outreach has been operated the way it is now since 2007, right? So, and that it actually works well. I'd say the thing that sort of like gets in the way at the moment of it working better is vacancies, right? And which is, has going back to the pay issue, right? So I should check the outreach team vacancy rate, but our agency vacancy rate has been hovering between 15 and 20% for a couple of years now. And I think you'll find that that's a very similar vacancy rate of other social service agencies in the space. And it's all due to the same thing. It's a shortage of both social service workers and healthcare workers and mental health debt, which includes mental health care workers, which is multifactorial. But I would say pay parity is the primary reason for that. So I'll say two things that I think are probably the most impactful things that can be done, like sort of in the short term, which is the COLA, cost of living adjustments that Councilwoman Rivera mentioned. And here's another thing that apparently in the mayor's proposed budget, there's a 2.5% cut in proposed in Department of Homeless Services contracts, right? So I would imagine that would affect us directly, and in programs that are already really, really struggling to recruit and retain workers, with salary being really the primary reason for that, or one of the big reasons for that. An additional 2% contract cut across the board would really make it much more difficult, and perhaps even offset any COLAs that would sort of be forthcoming. So those two, sort of like bald money issues, I think, could be really high leverage things to advocate about. And I'll stop there. There's a million things I could talk about, but I'll stop at that.
Okay, so far, did committee members have any questions? Right now I see Susan's hand raised. Susan, go ahead.
On the contract cuts,
Mm.
is that to programs, cuts in salaries? Or does it also include like safe havens, cuts in contracts for safe havens and, facilities like that?
My understanding is that the mayor is proposing sort of an across the board 2.5% cut in all contracts. So for example, like we have a contract with the city to operate a safe haven, 2 safe havens. And my understanding of this proposal is that it would just cut both those contracts by 2.5%. I don't know if those cuts are targeted in a specific way in those contracts. My understanding is that they're not. In other words, it's just 2.5% off the top, and then I don't know how it would be determined where the cut would come from inside the contract.
So that means that a provider that has a contract to operate a shelter or safe haven, they would be getting a cut also?
that is my understanding. I'm getting this a little bit third hand, but when I mentioned to one of my colleagues that I was going to be attending this meeting, they said, "Oh, mention this." So
That's totally in conflict with everything the city says they're doing.
I agree. I agree, which is why I'm wavering a little bit, because it is hard to believe, and I don't want to say something that isn't true, but that is my understanding of what's going on. That's in the proposal. That's in the mayor's proposal. So I guess it's at least worth asking about.
Is this for the budget for cut in contracts for the budget starting this July?
That's my understanding. Right, that this is a proposal that would be haggled about for this budget. That's my understanding.
Yeah, haggle's the right word.
Yeah.
I'm sorry, what did you mean by vacancy rate? What, the shelter vacancy rate?
Oh, no, sorry, the employee vacancy rate,
Oh, okay.
right? So, right,
So they're unfilled, there are job openings, but they're unfilled.
correct. Unfilled positions that are existing positions.
Okay, are there any other questions from any of you here at the meeting?
If no one has one, I'll ask more.
Okay.
Okay, yeah, go ahead. I don't see any other hands raised right now.
So what we're seeing in this community is a lot of people on the street who seem to have mental illness
Mhm.
or have substance abuse
Mhm.
problems, or both. And, you know, we understand that a lot of people are being placed or accepting services, but there's a lot of people who aren't, as well
Yeah.
as new people.
Yeah.
And so I think that's why we're saying, you know, we have this problem more than before. I think in the beginning of COVID, when people had access to hotel rooms as opposed to shelters, it seemed like we saw less of this on the street. But even for mental illness, we have, it just seems like people are on waiting lists from what I hear for mental health services. So are you aware of, for like IMT or any of these, you know, other outreach services? Are there waiting lists? Are people able to actually get what they need? Because why are there so many people on the street?
Yeah, so I'll get to your IMT question, but I'll start with you're absolutely right to identify sort of at least two cohorts of people. That's people who are declining services, right? Like almost every person who's unsheltered in Manhattan is known to one of the outreach teams and has been offered all kinds of things, including either a transitional shelter or even some people, even permanent housing has been offered already and has been declined. And then the second cohort is sort of people who are, you know, newly coming into the space, to unsheltered homelessness from who knows where, right? And then, so for the first cohort of people, the people who are declining services, what's required is, you know, for the teams to continue to offer things to those people and to develop, you know, trusting, effective, you know, relationships with those people, which can often take weeks and sometimes months, and in some cases even years. Now, and this goes directly back to the staff vacancy problem, right? If there are fewer, you know, outreach social service providers and outreach mental health providers and street medicine providers, then, you know, we just can't spend as much time with people or have as many contacts with people as we would like to have, right? So let's say it would take me like 6 months of seeing somebody a couple times a week to gain their trust. Well, if I could only go once a week because I'm covering for 3 other people, then it's going to take a year, right? So that's one issue that's going on, right? You mentioned IMT, like, I think IMTs are, there's a great article, by the way, about IMT in the Times
We
today.
saw it today.
Yeah, it wasn't about us, unfortunately, but I thought it was really described well what's going on with IMT and why it works so well, right? Right, God bless the people who do it, right? I do believe there is a waiting list. I don't know how big the waiting list is. As I mentioned in the community board meeting last week, IMT teams are right. I say we don't need more outreach teams. We have enough outreach teams. We just need to fully staff them. But IMT teams, because the outreach teams are they're geographically, situated, right? But IMT teams is slots for people, right? So the more IMT teams you have, the more people you can serve, right? So an IMT team serves 27 people. So if there's 270 people, I'm just making that number up, 270 people waiting for IMT services, then you need 10 more teams, right? So it's like, it's a math problem, basically. And so back to the people you mentioned earlier, like the cohort of people who are like repeatedly declining services, those are the people who, right, I described this earlier, right? The more intensively you can engage that person, the better chance you have of getting them hooked, right? Well, what entity in the city right now does that the best because they're well resourced enough to do it? IMT teams, right? So, and then we have 8 IMT teams that work really closely with the outreach team. So that's been a really nice, actually, combination. It works because it's the IMT team and the outreach team are from the same agency. So that, and sometimes it's even the same, it's all the same group of doctors, and psychiatric practitioners working together. We're sharing a medical record, all this kind of stuff. So the coordination works really well. And so there's an example of an additional team actually helps. Sometimes if you just put additional team in a geographic space, it doesn't help. It actually makes things worse. But IMT is an example of it actually helps.
I want to just go back to something else. You had mentioned that there's a lot of staff openings.
Yeah.
That haven't been filled yet, and they're funded, I guess.
Yeah,
are these
they're funded.
staff positions that are paid for by the city?
Yes, they're funded, albeit underfunded, because the salaries are big. They're not high enough.
Okay, right, they're underfunded,
Right,
but they're
right.
so.
But they are funded,
first,
yes.
Right, so first of all, the reason why they're underfunded is that they need higher pay, so there needs to be more funding for higher pay. But my other question is, if they were all filled, if the positions were already filled and there were people working there, is there enough people? And if not, we need more than that? More than the openings?
Yeah, yes. Are there enough spots on the outreach?
No, so let's say you
team?
fill all
Yeah.
the positions were filled.
Yeah.
Would you say, and people are working? So are you, the staff is working. So is there a need for additional staff? Or is that enough? Or is it not enough?
We haven't been
Or do we
fully
have to ask
sounded so
somebody
long.
else?
It's hard to know. No, yeah, it's hard. It's hard. I'll tell you, my guess is if we were fully staffed the way it's designed, I think it would be enough.
Okay.
I'm not going to, I wouldn't, if the Department of Homeless Services said, yeah, we want to add a couple of spots, a couple of social worker lines to your outreach teams or additional psychiatry time to the outreach teams, I would take it. Right. So I'll give you an example. Right. So right now, the downtown Goddard outreach team, I might not get the number exactly right. It has half-time psychiatry. Right. It's actually two different psychiatrists, but so for 2.5 days, there's psychiatry on that team. It certainly would be better for there to be more psychiatry time on that team, because then there'd be psychiatrists more often going out to try to engage people, including the people who are declining services, including the people who are telling me to go away. Right. But then, like outreach psychiatrists become outreach psychiatrists because they don't take no for an answer. So yeah, sure. If there was an extra day of psychiatry, for example, then the psychiatrist would be out more.
Okay.
So that's sort of another answer to your question.
All right, yeah, so, because I
Yeah.
was trying to figure out what we want to advocate for, but I think the first step seems to be pay parity, even to fill
That's
those.
the first thing, yeah, right. I can't, like, for instance, it's hard to recruit psychiatrists because they're being offered salaries I can't even touch at other, everywhere else in the city, so.
Yeah, we hear that all the time from everybody, and, the Connect program is the same thing.
Sure,
Um,
yeah, absolutely.
They say the same thing. So, it's already 7, I know we got a late start, but it is 7:21. And I see, Susan, you have your hand up,
Yeah.
but do any other people have their questions? It could be about this, what Dr. Yu is talking about, or maybe a more overarching question related to what Carlina was talking about and her mental health roadmap. But Susan, why don't you go ahead since you.
I just want to know, for the psychiatrists, are they funded by DHS or Department of Health?
Oh, that's a really good question. So on street outreach teams, that funding is coming from the contract with the Department of Homeless Services. So they're funded by
Well,
DHS.
they definitely want more. I mean, they have told us very specifically they need more more outreach workers. But I don't know for the psychiatrists, who's funding the psychiatrists that coordinate with the outreach teams.
So the outreach teams that have psychiatrists, that's coming from the DHS contract.
Okay.
Right? And I'll just give you another example. You mentioned Safe Havens earlier. Same thing, right? There's Safe Haven contracts have funding in them for psychiatrists. That's coming from DHS.
Well, they do have funding, but I know when they sign the contracts, they try and cut out every penny they can, like have them work shorter hours and that sort of thing.
Sure, yeah,
So I do believe funding is an issue for them.
I agree.
Excuse me. Oh. Hold on. Okay, there. There's an
Just one more.
attendee, Julio from Carlina's office is in the attendees, and so is
Oh.
Deborah.
We lost them both. And Julio wants, yeah.
And he has his hand raised, and also.
Yeah, I'm trying to. promote her. They keep going back and forth.
Okay, Julio.
Yeah, thank you. Sorry about that. I'm not sure what happened. I just wanted to say, if you guys had any questions like budget related, that we might not be able to answer, that I can get back to you. So I know that 2% cut from the mayor's proposal. I can go ahead and find out exactly if that's going to cut services for Safe Havens and then get back to the committee.
Yeah, it'd be safe haven shelters and, all the facilities that have contracts.
Oh, Julio, could you, I don't recall if Carlina mentioned it, but, just the timeline for all this. I mean, she said we should support everything in the mental health roadmap. There weren't any particular bullet points. What is the timeline for this? Is it something, in terms of our support, is it to be done at the end of May or the end of June?
The end of June.
So-
is too late.
Yeah, the budget is done by June, right? The end of June, it's supposed to be finalized.
Mhm.
So in terms for, budget increases, any sort of thing like that, that should be done by the end of May. In terms of the mental health roadmap, that was heard today. So, it really just depends how fast, the speaker and the council is going to take it. But we're already very ahead in the process because now it's up to just a stated vote. And I can keep, the committee informed at the process, but I would say a month or so before everything is, but that could change, but I can update the committee. I can ask our legislative director to see when does the mental health roadmap and all that legislation, when does he expect that to pass? And then as for the budget, like Susan said, by the end of this month would be great.
Okay. Okay, yeah, so we could find out about the timeline, especially for the legislation, since that,
Yes,
you know,
I'll get
all-
back to
like
you.
goes into the next year. If it doesn't pass this year, then that would be good to know.
Well, if it's going to be funded, though, the funding has to be next month, right? I mean,
Yes.
we would have to vote this month to support it next month
Okay.
because it'll start in July.
Okay, Arnett Scott.
Hi, good evening. With the mental health, is there any component, I was trying to find, any component that is designated also for substance use abuse? With the funding for mental health?
Is this a question for?
Sorry.
It could be Carlina's office. Yeah, Carlina's office that has who I'm asking the question to, or anyone that has the answer. I'm not picky.
Give me 1 second. Let me just triple check. Yeah, so the mental health that roadmap does include expansion of support and connection centers, which offers short-term clinical and non-clinical service with people with mental health and substance use needs. So it's a very comprehensive plan that also takes that into consideration as well.
Okay, thank you. Because a lot of people struggle with both, some induced by substance use and some medicating themselves because of mental health. So I just wanted to know if there was any additional anything for substance use. Thank you.
I can make a comment about that that's a little bit different, that when you're funding, mental health services at our outreach teams, safe havens, and shelters, you're actually are also funding substance use disorder services, because we psychiatrists at Janion anyway, right? Like, we consider our work to include providing that kind of care, in addition to providing mental health care. To us, it all comes together. So we certainly offer people what's called medication assisted therapy, for example, even if they're outside. If they're willing to accept it from us, we'll provide treatment to people who are, living in the park.
Yeah, I think we also have organizations who in our area who focus more primarily on the substance use abuse work. So that I think that's why Arnett was specifically
Sure.
asking.
Yeah.
Okay,
Yeah.
good.
There's like there's at least two ways to get to people. There's the brick and mortar places that are sort of specialized in offering substance use disorder services. But that depends on people going to, those are good and we need more of them, but that depends on people like actually going to them, right? And then Janion is this niche that we're providing care to people where either, in the park, like, so that the person doesn't have to go to a clinic, or at places where they're accessing shelter or other services, right? So we're not depending on people to like sort of vote with their feet and make it to the clinic. So that's like the value of placing like primary care and mental health care like at the shelter, at the safe haven, with the outreach team, etc.
Okay, that's good to remember. Any other questions? Okay, well, I don't see any right now. And our next thing that we have to do is come up with something that we will vote on at the May full board. So we do not have a draft resolution. Our first, before this meeting, we thought, there would just be some bullet points about programs to support more. But what we seem to be hearing is that the entire mental health roadmap, needs support, and, our community board could, pass a resolution that supports the entire roadmap. Okay, so there's two parts. There's the funding, which is time sensitive because, the budget is decided by the end of June. And then there is the legislation, which may or may not be time sensitive, depending upon what the legislation is. So what's the best, I'm not sure what is the best way, Susan, you think, for us to tackle this?
I
So we
think,
will, so we can, we can still draft some bullet points. And maybe not all the exact language tonight, because we don't have anything, drafted already. And then we can still, committee members can still input at full board.
if you want, to make it easy, based on, particularly what Carlina said, you can vote to support the mental health roadmap and specifically a top priority of pay parity for human services workers. And you could just vote on that, and then the office can write it up with you and have it ready before the full board. And then if someone wants to make any tweaks at the full board, they can.
Yeah, that sounds like a good solution. Are there any committee members opposed to that solution? Opposed to the proposal that Susan is suggesting about how we go about this? If you are, raise your hand. Or if you're in favor of this, raise your hand. Let's put it that way. Okay, so we have Arnett raised her hand, Thomas. Okay, so this is not a vote. This is just, I'm just taking a temperature check. Larry. Okay, we have, many of the committee members here are in favor of this, this path. So should we do we need to vote on anything tonight?
Yes, you should. Yeah, you should vote on specifically a resolution to support the mental health roadmap with the top priority being paid parity, and then we'll fill out the resolution, but you should vote on that.
So would it say something like, therefore be it resolved that we support the New York City Council's mental health roadmap?
Right, and you want to add with the top priority being
Well, with the top priority being pay parity for
that would
the
be
human service workers.
Thomas has his hand up.
Yes, Thomas?
I never put my hand down from before. Sorry about that.
Okay.
Okay. All right. Okay, so are we ready to vote on that, on what we just said? Therefore be it okay, so the therefore would be, therefore be it resolved that CB3 supports the City Council's mental health roadmap with a focus on, need for pay parity for human service workers. And then we'll write it out later. The entire reso, and we'll draft something and have it at full board, or I could even, if we get it in early in time, I could even show this committee a draft, but it would be discussed and voted at full board. And like as Susan said, if you have anything else, to add or say, it can certainly be done at full board. So Thomas, I think that means you, no, okay, so we'll do this all at the end. When we do the attendance.
Okay, so you're going to vote at the end.
Yeah.
Okay.
Is that okay? Okay. All right then. Okay, so thank you all who are here to present on this agenda. We're going to move on to the next agenda item, and everyone else is welcome to stay, but of course you are free to go as well. So our next agenda. Okay, bye-bye.
Thanks very much. Thanks for having me.
Thank you.
All right, so our next speaker will be from NYU Langone, and they are here to present to us about their lung transplant efforts.
Thank you.
Ashley?
Yes.
and
Hi.
others.
My name is Ashley. Thank you, everybody, for letting us present at CB3. I am a postdoctoral fellow from School of Medicine at NYU, and I've been a nurse for over 15 years. And I'm working with Dr. Stephen Wall, who's also here on this project. Okay, we can't share a screen. Okay.
Oh, you're not able to share your screen?
Yeah, I can't share a screen. I think it will help visually.
Oh, you cannot. Susan, can you give her?
I'm doing it right now.
Oh,
I'm doing it
okay,
right
okay.
now. Okay, you should be able to now.
Oh, great. Alrighty, can everybody see? Great. So our study is called UDCD Lung Protocol Planning, and the purpose of our presentation is just to educate CB3 on our new lung protocol and also some background information on lung transplant in general. And so what is lung transplant? Lung transplant is the surgery to replace a diseased or failing lung with a healthy lung, usually from a deceased donor. And a lung transplant may be needed for the following conditions: severe cystic fibrosis, COPD, pulmonary, bronchopulmonary dysplasia, pulmonary hypertension, heart disease, pulmonary fibrosis, or smoking. And you can also check for your donor status on your driver's license on the right bottom corner. And if you are interested in register to be an organ donor, you can go to donatelife.ny.gov or call this number on here, or go to your local DMV. There is an organ donation crisis in the US right now. Every 15 hours, a New Yorker dies waiting for an organ. And vulnerable populations have a much higher rate of chronic illnesses that may need organ transplants. Black, Hispanic, and Asian populations have less access to lung transplant, and there's not enough donated organs to meet the needs of these communities. And I want to share a data with you. The bars in purple represents NYU, and the bars in yellow represents the national data. So as you can see here, NYU centers, they transplant a lot more than average, more than the national data on diverse populations for lung transplant. So NYU serves the diverse needs of New York communities. As you can see there, we transplant a lot more lungs in Asian recipients, Hispanics, and Blacks as compared to the national data. And so why this study? Like I said before, not enough organs. We don't have enough organs to meet the needs of our communities. And our strategy is to expand the number of available lungs via uncontrolled donation after circulatory death, meaning those who have passed away unexpectedly in the hospital setting are given the opportunity to donate their organs to save lives, should they choose to. And this strategy has been widely utilized in Europe and Canada. So we're seeking your feedback on our protocol that will be rolled out in New York City. And if this UDCD, our study, is successful, it could increase donation opportunities in the US by thousands, and also cut the waiting time for an organ as well. And what sets our protocol apart from the regular lung donation protocol is that we are putting this bag valve mask or ambu bag on the deceased patient when we're contacting their family. This way we can extend the life of the lung, the organ, should the family decide to donate the lungs, because the lungs will not be good for transplant after 3 hours. So that if the family decides to donate the organ after 3 hours, or even before 3 hours, then we cannot transplant the lungs even if they want to. And as you know, there's a lot of people who comes into the ER that are not registered donors. So this is what our study is mostly focused on for those that are not registered. If they're not registered, we will connect the ambu back to the deceased and contact the family. If the family object, the inflation will stop. So we respect everyone, whether they're organ donors or whether they're not organ donors. So if they don't want to donate their organs, then we will not inflate their lungs. And this protocol will be rolled out in NYU Tisch, Bellevue, and NYU Brooklyn. So CB3 will be affected. You are the stakeholder in our protocol right now. And we hope to establish a 3-way partnership between government officials, doctors and nurses, and the communities to ensure our program acceptance and sustainability. And community members are the ones being impacted by this protocol, as I said. And so we want to address their concern and be transparent as possible and establish trust between us and them. And so these are the stakeholders that we're currently engaging, including East Asian community, South Asians, community board, Latinos, Blacks, religious organizations, different hospital boards, advisory boards, community boards. And we're also engaging doctors and nurses, social workers, and clinicians like that also for their feedback on our protocol, because we just want to make sure that we're covering all the areas. And so if you're interested in engaging in further discussion with us, we're also looking for community members to join our focus groups, and it will most likely be online and it will be 90 minutes. And the protocol will be presented to you in a more detailed presentation. And you will receive $50 Amazon gift card. And anything you say will impact our protocol because we really, really want the support from our community members. And so some of the questions will be like, what are your thoughts about the protocol? What will be your perceptions from your community and things like that? And if you're interested, my contact information is in below. And this is our team member. And we're also here to answer any questions that you have about lung transplant and our study that's going to be rolled out in a year. So thank you very much. You have any questions?
Yeah, thank you, Ashley, for presenting everything. And I really thank the community board for hearing us. We did a similar program like this back in 2010, and we were successful in that the community and all the stakeholders around New York were supportive of a program that we did for kidney preservation at that time. We stopped because of lack of funding, and also a lot of the government stakeholders were really worried and they made it very restrictive. And one of the restrictions was that you had to be a previously registered donor to qualify. So the crux of this program is really to study, can we do this very small task after death to preserve the lungs, and just by inflating them a little bit, we'll protect them for 3 hours. So we're going to be doing that. Obviously, if you're registered, we should have the permission to do that. The question is, will the public be okay with us? And I have to clarify. So it's only people that we've resuscitated for 30 minutes at least, to make sure that we really tried everything we could to save their lives. By the way, I'm an emergency medicine physician by training. I work at Bellevue Hospital, just to give some context. And after an unexpected death, after we've tried everything, we wait 10 minutes to make sure that there's, the person actually is dead. And then what we would do is we with the existing tube that was there to try to resuscitate the patient, put a tube in the lungs to try to, help people breathe. We just reattach this bag, that ammo bag, and put a little oxygen in there. That's it. And then that actually would give people an opportunity to donate if they wanted to. And so the question is, will community members be okay with that experience? And we have a lot of checks and balances in place. We'll be also during the protocol, once it's well designed. And what we're doing is we're reaching out to communities right now to make sure to get their thoughts on that. Because if people universally say, no, we don't want you doing that, we don't have to do it. It just means that we'd have less chances at recovering organs. But this work has been successful in Canada. It's the same protocol. It works clinically. But they waited to get authorization, and their yield was not, it could have been much improved if they could have just inflated the lungs earlier on in the process, and the lungs would have been better off. So if anyone has any questions or concerns to voice, please tell us now, or at least please consider joining one of our focus groups, because like I said, we really want to, like Ashley said, we just want the community involved with this to make sure we're doing everything right and that we're representing the community as opposed to dictating to them.
Oh, okay. Yeah, thank you very much. I think Deborah had her hand raised.
Thank you. I guess this is something that I'm not used to sort of hearing a lot of information about. But currently, without this protocol, does that mean that you don't have the capacity to preserve or keep lungs long enough to be able to utilize them? Is that the difference?
Yeah, so essentially there's a shortage, right?
Thank you.
So about the wait list for lungs nationwide is about 3,700 people, and maybe I think half of that, it's 3,400, and about 1,700 or 1,000 are transplanted every year. But it's a little bit misleading, because the reason why the list is low is that people are dying every year, another 1,700. And the disease process, like she said, like Ashley had pointed out, as far as our community is probably served by Community Board 3, when you look at COPD or emphysema is a big problem, obviously. Pulmonary fibrosis because of the World Trade Center. Anyone who's being seen in those clinics, that's an issue right now. COVID, we suspect, will actually increase demand because people with had severe COVID, the lungs might actually need transplants later on in life. The Jewish community, cystic fibrosis is an issue. But so we just don't have enough lungs, and lungs are very difficult to acquire. You can't, like a living donor doesn't give a lung, right? So kidneys can get a living donor. And in this case, brain death, sometimes, believe it or not, with the traditional ways of getting organs, like brain death, the lungs actually get damaged. So we just don't get them as often as we would like. And so if we just inflate those lungs, it just offers more people an opportunity to donate, and that's it. Yeah, and it's non-invasive, no scarring, no, we're not doing anything without permission. If we don't get authorization, we won't be doing anything. In fact, what we would do is, once you've learned that your loved one had died or whatnot, we basically say, well, we just put this bag on to give you that opportunity. Please allow us to continue, like as a permission, and you take some time to consider donation. You have maybe 2 hours or something like that. But without that, then the lungs won't work well. That's the issue.
Thank you.
Are there any other questions?
I think everyone is so focused on mental health problems. Believe me, I'm also seeing all that too. I mean, what do you guys call it? The roundups? I mean, they all came to my ER. I would take care of them, and then we have nowhere to put them, so we just release them back out for them to come back again another day. So I can certainly see why that's a problem for Community Board 3 for sure.
Susan, did you have a question?
Yeah, it's just how do we get information about the focus groups?
I put my email in the chat box, so anybody who's interested can reach me and we can schedule a focus group together.
Okay, if you're, I just think if you want to get a lot of people, maybe having a flyer or something to, to give out, and that we could even, if we go to meetings, give out, that might be helpful.
That would be great too. We do have a info sheet that we can send to you. If you could pass it out, that would be great too.
Okay, Susan,
Arnett.
Arnett, yeah.
Oh,
Exactly. So you have a treatment, individual treatment.
Oh.
Arnett Scott, did you
Okay.
have a question?
yeah, sorry, I was having problems with my mute. Because for some reason my phone is low and I can barely hear you. Did it change, has the rule changed that the donor has to be a previous, before this incident, before the time of death, they already have to be organ donors? Has that changed, or is that rule remains the same?
No, the new program, we will be considering people who are unregistered as well. And for those cases, we will contact someone who can authorize on their behalf. And that's why what makes this unique. The first attempt, we were unsuccessful because of that restriction. But in this case, we don't have that restriction.
Okay. All right. Thank you.
Okay, thank you, Arnett, for your question. Okay, one last call for questions. Okay, I don't see any other questions. So thank you for presenting about this important program.
Thank you.
And thank you.
And thank you for having us. Thank you.
Okay, thank you for being here. All right, so our next agenda item will be district needs and budget priorities. Okay, this is our time of the year when we start talking about district needs and budget priorities. So we will, so we'll start some discussion. We have, there's a lot of material that committee members need to look at, which we haven't shared with you yet. Some of it is actually on the website. Those of you who are in the committee last year at this time, then you will recall having seen it. But first, Susan, did you want to give just a brief intro? And we'll give the intro again next month, but this will be very brief because next month we may get new members.
Sure, and I think it would be good, I don't want to read a lot of stuff to you. So I think it would also be good if after the meeting, I sent you maybe just two pages that are an overview. It's the same ones we used last year. But I think what I'll do is start by looking at our fact sheet on capital and expense budget priorities, because it kind of explains the whole process. So let me see. I'm sorry, I'm going to do the opposite and start with the district need brief summary, because that better explains the whole process. And then I want to talk a little bit specifically about our budget priorities from last year, because we just got answers to them yesterday for the executive budget. So first of all, community boards start their participation in the budget process at this time every year. The mayor and the city council are finalizing the budget for the coming fiscal year, which starts July 1st, which is what we were talking about with Carlina. And we start now working on the budget for the following year. So we're going to be working on fiscal year 2025 budget, which will start a year from this July. And our first step is the district needs. One of the things I'm going to send you, or May will send after this meeting, is just the human services section from district needs last year. It describes our community, conditions that give rise to the needs, such as, example, a number of seniors living in poverty, assesses the needs with a focus on unmet needs or problems. And we can recommend projects or activities that might meet the needs. we don't have to have a solution for every problem. The purpose is is basically to show the needs. And then when we do our budget priorities, we try and have priorities that will meet the needs as much as possible. There's always a tendency to want to write a lot about policy. This is not a policy document. The committee should overview the areas in their jurisdiction. For us, it would be senior issues, education, youth needs. We could invite nonprofit providers to help inform us about what the needs are. And additionally, this state serves as a statement of the story of our community. Many, many people use that district needs. They use it. Hospitals use our district needs statement when writing their needs assessment. People giving grants or wanting to know where to even volunteer or help use our district needs statement a lot. We finalized the district needs statement in July, and then so each committee will update and their own section, and then the full board will vote on it as a whole. And we try and finish it in July so we can then focus on the budget priorities, and then vote on everything together in October. Part of the process of doing this, the district needs is kind of researching, updating statistics. Budget priorities, we need to gather a lot of information. One of the things we do is have meetings with agencies. In September, the 12 Manhattan community boards have group borough-wide meetings. The chairs and the district managers attend the meetings with the agencies. And in order to prepare for those meetings, we write the agenda. And our agenda is, what do you want to know in order to vote on budget priorities? What programs do you want to know? For instance, if you want to know about funding for IMT, you might want to know how long is the waiting list. That'll give you an idea of whether they're meeting needs. You might ask for summer youth employment. The agency will tell you that they funded so many thousand kids. You might ask, as far as your budget agenda, how many kids apply, how many kids were turned away. So you're asking questions that will give you a better idea of how you want to vote. You want to ask if budgets are fully funded. You may want to ask reasons like free legal representation for low-income tenants. Is there a problem if there's a waiting list? Is the waiting list because there's not enough lawyers, or is it because of a funding issue that they could hire lawyers but don't have the money? So it's kind of getting to the bottom and trying to analyze the programs. Our budgets, our priorities from last year are on the website. We vote on 25 expense and 40 capital priorities. Generally, most of the top 10 priorities are from this committee because our community has a lot of needs that are not being met. That's a little bit of an overview. I realize that was kind of spotty. If there's any, so what I would like to ask from the committee is in June, I would like to hear, and this is not something you have to vote on, I would like to hear from you questions you would like to put on agendas for committees to find out about programming needs.
Right, yeah, so this is about the district needs. Yeah, so the thing is that we're talking about district needs now, and then, but the funding is later is going to take into effect a year from now. So there is this time gap, but there's nothing we can do about it.
Right, so in June,
is.
I have to submit the agenda items for the budget priorities in June. So in June, we're going to be starting the district needs process, but at the same time, I'm going to ask you, what programs do you want to know about so I can put them on the agenda? I have to submit those in June. I usually don't get too many questions, but I try and actually make up a lot from what I've heard in the committee all year, and they're put together with the other 11 boards. But if there's any programs you're particularly interested in that you want to know about, I would like to get those questions from you so that they're not forgotten.
And these are programs that are funded by, that would have been, these questions are directed towards the city agency that funds the program. So it should be, so you should be thinking about in that context.
Right, and almost anything this committee would be asking a question, it would be, I mean, you don't have to tell me what agency it is. I can figure that out. If you want, tell me about, you want to know about summer youth employment, I know that's the Department of Youth, a DYCD, or, you know, certainly for senior programs or NORCs, we know that's Department of Aging. Sometimes there are questions and I have to do research, like I didn't know whether the psychiatrists, some psychiatrists are funded by Department of Health, some by Department of Homeless Services. So if you have questions about that, I might have to do research on which agency, but I don't want you to have to worry about that.
Yeah, so the other thing we had, this idea, I asked you at the last committee meeting, that we said we may, you know, in terms of our district needs statement, we could possibly do a short survey and send it out to community-based organizations. Ask them, what are their needs, you know, or what do they think the needs are for this coming year, what we should put into our district needs statement. So I had asked committee members for some suggestions, but I didn't receive any yet. So today maybe we could start thinking of some questions that we could put into the survey. And we do not want the survey to be, you know, so long that, you know, somebody looks at it and says, oh, I'll do it later, which is what we often do. But, you know, something that they can do quickly and send and turn it around quickly, just so we have an idea and we're like maybe not missing something. You know, I do have, if you guys need a suggestion for questions, we could look at the, you know how we're doing that, we have the consultant doing the mental health survey, you know, with the different community organizations. I did just write up the 4 questions that she's asking, and I could share it on the screen just so you get an idea if you think that's what we could use to survey the CBOs. Does that sound good to everybody? Yeah, okay, now, let me see, I think hold on. Oh. All right, so these are, hold on. These are the 4 questions that we, well, I edited a little bit. So these are in the mental health survey, we said, everything is mental health. What mental health surveys do you offer? Are there any mental health services you wish to your organization? So I just deleted the word mental health, and there they are. Is this the kind of survey that we want to send to CBOs? Or there's other questions, or if these are not the right questions, we can discuss now. So these 4 questions are, what services do you offer? Number 2, are there any services you wish your organization offered that are currently not offered? If so, what? Okay, what is preventing your organization from providing this? Which of the populations below do you serve with mental health, with services? This was directly from the mental health survey, so. Any, Susan, you raised your hand. Deborah,
I suggested that we, do this, but in thinking about it, I think this, a lot of our organizations are huge and they offer a lot of services. And I think if we want to know what services they offer, I think we should go to their website and look at that instead of asking them. And I'm wondering if maybe an alternative might be to say Community Board 3 wants to advocate for needed services or services that are lacking, and what is the greatest need in your organization that you would like to advocate for, or words that will say that a little bit better, but what would you like us to most advocate for?
Oh, okay.
Because I just think our particular settlement houses are so big. We've just asked them to do this on mental health. And and even that, we had to do a lot of follow-up. I had to help the staff person by emailing the heads of organizations and saying, can you please get, your staff to answer this? So I'm trying to be kind of sensitive to that.
Yeah. After you mentioned, you suggested to me, I thought the same thing. They could write an encyclopedia. Deborah.
So I don't have the right language for it because my brain's sort of in almost shutdown mode here. But is there a way that a question can be posed from a strength-based position? In other words, what success, what has been highly successful for your organization that you think that would require funding to reach more a larger population? I don't have the language, but I'm wondering if there's a way to approach it from that aspect, something that they do well or something that they feel is really successful that needs to be judged up or could use more funding.
Okay. Put that in. Arnett?
Yeah, I had a similar thought going with this strength base, but I was going to ask, and also with Susan, for us to ask an ask of the settlement houses of where they, where do they see the most need, and what services that you're providing that you feel require either more funding for, for whatever, marketing or what have you, and just get an overall, basically a questionnaire giving an overall view where they see the community having the most need based on what's coming in. Because like Susan said, our settlement houses deal with a whole host of different things. And I'm sure there sometimes they have brainstorms or think tanks in which they would like to branch out to something else, but either lack the funding or the staffing in order to pursue some of these things. So just getting a benchmark or just getting some information from them where they see the most need for the community. So it would be piggybacking off of what is it that you would like to see, and or what is going well for your settlement house that you would like to promote or have added funding to.
Okay, good. Anybody else?
That's 3 good questions.
Yeah, okay. Let me stop this thing. Yeah. Oh. Yeah, that were very good questions. All right, so we'll draft something, and then maybe we can just there's something that's something we can pass around, those 3. Okay, excellent. Any other comments on this? Okay, so is there anything else we need to do?
Well, I would say 2 things. One, is there anyone that you would like to invite next month that regarding, regarding any needs or any specific programs? Or,
Committee members, any suggestions? Because we would start inviting next week.
I mean, last year, I think we had CEC one come and they talked about a need for after-school programming.
Oh, and speaking of CEC, Arnett, we could invite them again, and also Arnett, you're going to get us the top priorities. I'll get back to her later.
Okay. May, would it be possible for a few minutes to just share what I sent you on the expense budget priorities and requests? Those are for the executive budget that were just released yesterday, and they have answers to our priorities from last year. If we could just go through a few of them, I think would be good examples.
Okay, you'll need to wait a few minutes. Oh, over there. You're talking about the budget priorities?
Yeah, it says fiscal year 2024 executive budget register.
Okay.
Might say FY24 budget priorities.
Oh, no, okay. We will. I'm very sorry.
So letting your screen share.
No, I thought Larissa would be here, but
Yeah, I think she thinks that she's only a member for a few more days, and I think she probably thought that the term was up.
mhm.
Well, if you can't do it, maybe I can just read a few of them.
All right, let's see. Maybe I can. Well, you could read them anyway. I will.
Here we go.
Big enough.
Yeah, no, a little bit bigger. Okay, so.
Yeah, again, I'm sorry, that's what I can do right now.
Okay, so let me just go through that. So I'm trying. Let me see, I'm just trying to find the capital budget. So I'll try and read it. So we voted on some capital priorities last year. The first one was to upgrade the senior center in Rafael Hernandez houses. That's 189 Allen Street. University Settlement has a senior center there that for years we've been had in our district. Need was we actually did a little story about it in one of our district needs statements a couple of years ago. And we've been asking for funding for that. And their answer to us is that we should bring this to the attention of our elected officials. And actually, a couple of months ago, it got so bad that we had, I helped get our new Congressman Dan Goldman there to take a tour of it. I don't know what's happening yet. The next one is to create a new school, a new elementary middle school that would be for District 1 and District 2 in Essex Crossing. And let me see, you went too far, right there. Located. Their answer was, and it's interesting, OMB supports the agency's position as follows: community boards located in sub-districts without identified seat needs. So what they're saying is that we have plenty of empty seats. We don't need a new school. We keep saying that our schools we have schools that are actually 100 years old, many old schools, and they don't meet our needs. The city will not use that as a criteria. So what the committee needs to do, if you want to pursue that, you have to actually do a lot more advocating and get elected officials to support the need. And if you want to go to some expense, okay, let's go to the expense priorities. Number 2 was funding for more homeless outreach. And OMB, they answered and said, basically, they didn't answer our question. They said, call 311. We asked for more money for runaway and homeless youth programs. And they said that they are increasing that service area. So we may, have some effect on that. But these are just examples. I will send this to you. What I did is I took out just the human services priorities, so I can send that to you. But I do have some good news. These answers are pretty terrible. And I think, May, when you got the first batch of answers, you mentioned that they were pretty terrible. Most community boards in the city decided they were pretty terrible. And there is now a group of 59 from all boards, district managers, that have been trying to work with agencies on this problem. We have had 2 meetings with OMB and city planning. And one of our biggest requests was to improve the answers, and they are committed to doing that. So I believe for the coming year, they've been actually very responsive on working with us. So I believe in the coming year, you can look forward to better answers for all the work you do in putting this together. And I will send out, or give to May to send out, the answers that we just got from the administration for our requested priorities from last year. We get answers in January for the preliminary budget, and then we get answers on the executive budget at this time of year.
Okay, yeah, thank you. Yeah, they were pretty much like non-answers.
They were terrible. They have drop-down answers, but their drop-downs are terrible. I use the answer on staffing for homeless outreach. I mean, we actually had 10 out of the 12 Manhattan boards, and quite a few. We had an in-person meeting about 3 weeks ago. City Hall came. I mean, we really made a big deal of it. We had a representative from City Hall there, and the agencies were amazingly responsive. We were very surprised. It's a change of administration, so these are new people. So we're very hopeful. But I used the answer for homeless outreach that actually says call 311. I use that as an example of the worst answer that you could possibly receive.
Okay. Yeah. So, so I just wanted to remind people, for our next meeting, we can invite, not community-based organizations to talk to us about their needs, just this, or the community needs for the district needs. In past years, we could do this in June and July.
Well, we should finalize it in July. So if you want to have people read over, our section of the district needs and bring notes or comments. The office will update the statistics. But if you want to bring, have people read it and bring notes to the next meeting, we
Yeah,
can.
no, I'm talking about inviting people. If we
Oh.
want to invite people to a meeting, we have one meeting to do it in, right? Which is June.
Right.
Okay. Okay, so does anyone here right now have suggestions? Well, I mean, CEC was mentioned, this school district 1 was mentioned. Someone we can invite just to talk to us more. Sometimes that's very helpful when they come to talk to us. So. Okay, I don't see any suggestions right now. Arnett?
Yeah, I can always invite Carrie to come back.
Okay,
Yeah.
our next meeting is on June 1st.
Okay, I'll reach out to her tomorrow morning and see if
It's
June 1st.
Thursday, right? That would be our next meeting, right? The first Thursday in June?
Yeah, generally I'll check tomorrow.
Okay,
Okay,
Okay.
I'll reach out to her tomorrow.
okay,
and see
thank you,
what's
Arnett.
available. No problem.
Is there anyone, we used to have Margaret Chin's office speak to us on needs for the aging, which are considerable, and it'd be helpful if we could have, there's someone, I don't know who the chair of that committee is. Do you know, Carmen? The chair of the aging committee is in city council?
Yes, I think it's last name Hudson. It's a young person. I've met with her actually last month.
I don't know, do you think I don't know if someone like, if they would come or not. When it was our council person, it was easy. I don't know if they would come talk to us about that. You want me to try, May?
She's based out of Brooklyn.
Yeah.
Let me
Well,
think.
when it was our council person, I mean, she was familiar with our district.
Yeah, that's
She
true.
herself was, a senior citizen. So so I don't know if
Yeah, is there anyone you
this
could?
person that you're talking about, maybe there's another member of DIFTA, of the committee for you're talking about the city council committee, who is a little bit more familiar with our district would be helpful.
Yeah, we
Carmen.
could look. That's a good idea.
So it doesn't have to be the chairperson.
That's
All
a
right,
good-
I'll double check the list and see who's on it, but it's not people that we recognize from the past.
Okay. All right. All
Well,
right, if we don't,
I was going to say maybe then we can just think of some good questions about the programs from the past to put on the borough-wide meeting with Department of Aging.
okay. Oh, so this is the meeting that you go to, Susan?
Well, hopefully you'll go
Borough.
too.
Are you talking about the OMB meetings?
Yeah,
Okay, okay. I thought it was another meeting.
no.
Okay, thank you. Okay, if there's nothing else on this agenda item, we can move on to the next one. All right, so the next agenda item is just CAB and CEC reports. Oh, I don't think, has anyone, I don't think anyone here has, Arnett, have you, is there any reports from CEC 1?
Yeah, let me open it up now. Okay. We had a couple of things I thought would be interesting here. Okay. Let's see. Oh, there's a program called City Truckers, and City Truckers basically gives our children an opportunity to see things throughout the city, museums. They take them on trips and stuff. It was really, really successful this summer, and they're going to be continuing it, but this time we have a caveat in which they're going to host 50 migrant families that have relocated to Lower Manhattan. And what they're going to do is take the children out just to get them to know the area and what school they're going to go to, what's by the school, what playgrounds are near. And during that time, they're going to also have programming for the parents for English language learners. They're going to have English classes for the parents. And also, they've lined up some private funding for a literacy collective intensive summer reading program, which would help 30 of our rising third graders, meaning from second to third grade. So in order to prepare them for state exams, so some free tutoring, intensive reading program for our kids. And let's see, we have, the participating teachers that would be facilitating that would be in hours also from our school district, PS 188, and 10 from PS 188, 10 from PS 34, and 10 from PS 134. And let's see, we're also having introducing a new literacy curriculum in our district, and they had asked the CC for some of our like a quick think tank sort of a thing, like what sort of curriculum would we like to see, what are some of the things that we want the curriculum to do for our kids. And and we gave a lot of insight about not only just reading, but trying to do some having something also to do with writing, because a lot of our students are struggling also with their writing skills. So they took that away, and also having different investing in different techniques to teach a variety of students versus having just a general curriculum, like having more differentiating teaching. So we were asking for that. And let's see, we have District 1 now has morning yoga events for our parents, which is something different. I forgot what school is going to be. I think the school was either 134 or 188 that was going to have the morning yoga. And let's see. This okay, we'll be okay. And they're going, and Summer Rising is happening again. And this time, Summer Rising is a free summer program for our students throughout the city. Last year it was first come, first serve. Now they're trying to implement a new process in which it's, I guess, more equitable. I don't know how they're going to do that, but that's what they said they're going to do. And let's see. I think that's really about it. This time I try to keep the agenda in front of me so I can give you a little more. Okay. Yep, that's basically it for our last meeting.
Okay, thank you, Arnett.
You're welcome.
Okay, I don't think we went to any hospital CAB meetings. Okay, we will need, in terms of CAB reps, we will need a replacement for our Bellevue CAB rep. It was Laura Lugo, who's now on another committee, and so she's no longer this committee, and she no longer wishes to serve on any hospital CAB to represent CB3. So we are, I think, finding out some more information also about what they have an application. They're always taking new people, but we just have to find out a little bit more about what's required on their end. there are many meetings to go to. You know, they have a regular meeting and they have subcommittees. So we just want to find all that out. And then, but if anyone is interested, you know, let us know. Were there any other cabs or CECs that are cabs that we went to? Larissa is not here. And yeah, I don't think any of the shelters had meetings, right, Susan?
No,
Okay. All right. Okay, so we're at the end of the meeting. Is there any old business or new business? And we will also take our final roll call vote, but is there any other old or new business to discuss? If so, raise your hand. Okay, it does not seem like that there is. So in that case, we will have our final roll call and vote. Thomas,
Okay, Maylee,
yes.
Thomas, yes. Larissa? Hannah? Eric? Eric, are you still there?
He's signed in, but
but
I
he's
don't.
not, looks like he's not there anymore.
Larry?
Can I just say, we should give Larry credit for the beginning of the meeting too, because he had trouble getting in.
Sure.
Yeah, I was in the wrong, yeah, I saw
Yeah.
your email, but it was
So
already kind
we
of
should
late.
count him, we should count him present.
Got it. Shirley? Shirley there? Deborah?
I'm here.
Thank you. Alicia? No, Alicia. Heidi?
He's not here.
Arnett?
Here.
Thank you. Rodney? Rodney?
I don't see him.
And lastly, Carmen. Carmen Perez?
Hi, present, although, yeah, was a little trouble in getting into this thing today.
Yeah, we should give credit. It was-
Yeah, it was kind of confusing between the Zoom and the presentation and the works, yeah,
It was
and the webinar.
it was a
So I
tech
think-
problem. It was the office's fault.
Oh, okay.
So maybe we can just, everyone who got in, like, you know, at least during the presentation, I mean, I saw people trying to come in. We should just
I think
count them
that's
present.
Carmen.
So I'll work with you on that, Thomas. So, you know.
Okay,
All righty.
thank you.
Keep breaking
We-
up.
I don't
Keep
recall
breaking
if
up.
Carmen was here when you called the attendance, but you know, there was a big struggle getting in.
Yeah, no, I was right after the attendance.
Keep
Okay.
breaking
I'll be
Open up
honest
here.
about it, it was right after the attendance.
I see
Okay.
someone very
You
cute.
still there?
There we go.
Hello?
Rodney.
Yes, Rodney.
Hello? Hello?
Hi, Rodney.
We got
Okay, I
you.
want, okay.
Okay, I captured Rodney's attendance as well.
Okay, great. Is that the end of the attendance?
Yep, that's the end.
Okay, thank you. Okay, so bye. We'll see you at full board. Okay, have a nice night, everyone.
All right, good night.
Good night.
Night.